been hearing about that all year, pretty
Yeah.
much. And I know Cox has taken on initiatives like the overseas nurses,
Yeah.
things like that. Are you going to be doing things like that in 2017
We
too?
will. My position is if there's a shortage nationally, I don't care. My job is to make sure there's not a shortage at our healthcare system.
Right.
And if that means that we create relationships with more colleges to help graduate more, our own college, or international nurses. And here's what's great about the international nurses. In the Philippines, where a lot of them will come from, nursing is a bachelor's required degree. In the United States, it's an associate's. They've got 2 more years than most. English is an official language of the Philippines.
Right.
They even nationally use Cerner, which is our information technology. So they literally come here using the same software even. And we've got a lot of Philippine employees already who are really excited about embracing. And when I think of the need to expand cultural diversity in Springfield, how great is that? And so
Sure.
we're excited about it. Our staff's excited.
Solves more
about
than one problem.
it. It does.
Yeah.
Yeah, that's right. That's right.
Okay. Do you still have a nursing shortage right now?
Absolutely. Yeah.
Can you put a number to it?
You know, I think so we probably have about 1,800 nurses in our system or so, and I think if we had 300 show up that were qualified, we'd hire every one of them.
Wow. Okay.
Now, that doesn't mean that we're running short necessarily,
Uh-huh.
because it means there's a nurse that's working more shifts and working harder, and there's a point where that's a lot to ask of someone.
Yeah.
And so we can manage that, okay, but we need to bring more on, and we're growing. And in some ways, our rate limiting factor in growth is not our facilities, it's not our doctors, it's our nurses. If we are occasionally on we've got maybe a busy ER and we've got patients that we can't take in, it's most likely because we don't have enough nurses to take care of them on the floor, so we have to be careful of that. Mercy and Cox probably both will tell you they could each hire 300 nurses easily. Our numbers are real similar. That's 600 jobs you could have in the community, and I can't think of an industry that could have that level of employment and that level of wages what could help our community better?
Right.
We've noted the data that we are kind of anomaly. We have very low unemployment and very high poverty, and usually they have a different correlation. Really, low unemployment means low poverty. We're the opposite. What tells me is while we have good employment levels, it's not good employment rates in terms of dollars that they're getting paid. So we can improve our economy. So I'm an advocate, obviously, for people to go back to school and go to nursing.
Yeah. Okay. What about expanding in terms of facilities? I think I just read today, probably press release. Cox is going to open a new urgent care center in Monette. Is that what I read?
Opening one in Monette, and we'll soon be opening one in Ozark as well.
Okay. So is that going to be? Is it going to be another year of facility expansion for hospitals?
Those aren't as dramatic as like a new tower,
Sure.
right? Those are trying to handle this ever-increasing volume of ER and urgent care patients. We saw in our system about 250,000 ER and urgent care patients last year, and year after year it's 3%, 6%, 7% increase on top of the year before, and we've got to offload those patients out of the ER into a more appropriate urgent care, so a safer setting for them. And our ERs are designed to take care of level 1 trauma and not something that needs an antibiotic. Yet that's the venue people have to them, so we're trying to increase access by improving those urgent cares.
Okay. So you're not seeing any huge expansions, but smaller ones like that?
I think organically there'll be some programs like that. Of course, CMH joining us is expansion for us, but they're existing. The other area that we're going to probably see big expansion, which doesn't have a physical footprint, is telemedicine. Our OCMed program, occupational medicine program, last year saw about 2,000 patients through telemedicine.
Right.
This year we forecast that will triple to 6,000. About a month ago we opened up through our Direct Connect program. Anyone can go online on their iPhone, iPad, their computer, and see a nurse practitioner who's got physician oversight. And a lot of us know, like I often know, my child just needs an antibiotic. It's strep throat, or it's something, something that can be managed that way. That will grow, I think, increasingly, and it's real affordable, and you don't have to leave the house. You can be waiting on your couch, watching a TV show, and wait for your doctor, and usually the wait time like less than 5 minutes.
Is that a more affordable solution for hospitals in terms of staffing? Does it take less to do that?
Yeah, it does, for a couple of reasons. One is if you think that if you go to an ER, that's an extreme example, you're going to this facility with all kinds of capital equipment, MRIs and CTs. You've got triage nurses, you've got doctors that are board certified, ER doctors, etc. You've got a registration process. This process is really simple. You get online, you register yourself, the data feeds, you wait, there's a nurse practitioner, and right now, every patient that goes into our ER is going to get a level of care that's for an emergency at the highest level, and we've got to be very careful because we don't know the patient. In a relationship where they're in our system, we've got their medical record, and they go to one of these, it's a $49 cost. An ER charge might be $1,000.
Yeah.
So it makes sense for everyone.
Yeah, okay. Well, great. With the amount of baby boomers retiring, are you seeing more of them coming back to work? And is that something that you're
Absolutely, and we
utilizing?
love that.
Okay.
What we're finding, kind of stereotypically, is a very active baby boomer. They retire, they have a lot of fun for 2 years, and then like, on board.
Yeah.
And maybe more that I want to continue to make a contribution. And so we've had people that convert after long careers in other industries, go back. In orientation 2 weeks ago, there's a woman that probably in her 50s, worked in banking, retired, and said, I want to go into healthcare, and got a nursing degree, and went back. We're seeing a lot of that. We're seeing a lot of people that have been in unstable industries be tired of that. They want stability, and so they're converting to healthcare. But really, while baby boomers are leaving the workforce, we know at a rate of 10,000 a day, in retirement age at least, we're hopeful that more of them will want to come back. And we find them to be great employees, right? Because they've got a work ethic, they're experienced, and so we welcome, and we know that a very high percentage of our employees are former employees, and they've come back. They've come back because maybe they had a family, or they've come back because they did retire. And sometimes when the economy is rough, maybe some of their retirement portfolios were hit by bad stock market, they need to come back a little bit and strengthen that.
When it comes to gaining new employees, picking new employees, and the workforce is increasingly made up of millennials, less so baby boomers.
Right.
How do you appeal to their sensibilities?
Yeah, so I think healthcare really appeals to millennials, and I'll tell you why. First of all, it's good because millennial generation is bigger than the baby generation, and we're losing them. Now, what we have done, our VP of Human Resources is a millennial. Our head of recruitment and human resources is a millennial, and they get it better than I do, right?
Sure.
I'm not a millennial. I don't know if you could tell that. I don't have colored socks. I've noticed that's a millennial thing. But what we've grown to appreciate is maybe different than generations preceding them. Millennials want to add value. They want to make impact. Money's not maybe as important for some millennials as it is to know that I'm contributing, and there's a sense of loyalty to their cause. And so I think healthcare is a unique fit because you cannot work in healthcare without feeling a sense of satisfaction and making a difference. And I think we appeal to that. I think that's part of our ability to recruit millennials. And we also know that we can't be as traditional. That means that we've got to make our work schedules more flexible. We've got to find ways for people to work from home when there's opportunity to work from home. So engaging our head of HR, VP of HR, and our director of recruitment as millennials, I think that's one of our key strategies. They get it better than I do.
Okay, well, that's great.